Meet Claire. Claire is now successfully managing her heart attack. Specifically, Claire's heart attack stems from a condition known as SCAD, which stands for a spontaneous coronary artery dissection. Surprisingly enough, SCAD accounts for 60% of all female heart attacks. Now Claire wishes to educate women everywhere. Claire is an associate professor at Western University, and one day, while marking midterms from her molecular cardiology class, Claire began to feel stress from the amount of bell curving she'll need to do in order to get a passing average. During the stressful period, Claire experiences elevated levels of adrenaline, resulting in increased blood pressure and more stress on the heart. She also begins to feel other symptoms like dizziness, stomach pain, nausea, excessive sweating, and chest pain. Claire rushed to her favorite doctor, Dr. Pyle, in hopes that he could explain her condition. After routine ECG and blood tests, Dr. Pyle diagnoses Claire with a heart attack. Luckily, he's familiar with all of Claire's symptoms, although they appear to be a little unusual. Dr. Pyle believes that Claire may be suffering from SCAD. SCAD is a tear in the coronary arterial wall that is not related to trauma, atherosclerosis, or medical instrumentation. This tear can lead to reduced blood flow traveling to the heart muscle, resulting in the potential for a heart attack. Claire appears to match the SCAD profile. Middle-aged females make up 90 to 95% of SCAD patients. Chronic stress, pregnancy, and tissue disorders serve as additional risk factors as well. Treatment options include monitoring of symptoms and the prescription of aspirin or other medications to prevent blood clotting within the artery. If conditions become more severe, surgery can be done to reroute blood to the heart. Unfortunately, even after testing, 97% of SCAD cases go misdiagnosed. So how can we be so sure? Well, to confirm Claire's diagnosis, Dr. Pyle decides to perform a coronary angiogram. For this procedure, he injects an X-ray dye to detect a narrowing or damage inside her coronary arteries. Here we can see the angiogram showing Claire's arterial tear. But how does this happen? As it turns out, the tear in Claire's artery causes it to split into two layers and form blood clots. These clots can cause the artery to become narrow, blocking blood flow to the heart. Fast forward to today, Claire continues to raise awareness of SCAD by including the topic in her classroom curriculum. Together, with increased awareness of SCAD among the public and medical professionals, heart attacks that derive from SCAD can be reduced. It is time to grow a network devoted to accurate diagnosis, superior outcomes, and answers. To learn more and help support the fight against SCAD, be sure to visit the following resources.